Welcome to the American Pharmacists Association podcast series on vaccine co administration and lifelong vaccine strategies for adults. My name is Cherokee Layson Wolf, and I'm a professor at the University of Maryland School of Pharmacy, and I'm joined by Tamara McCants, who is a assistant professor at Howard University College of Pharmacy. This is the second of three podcasts, and we will be discussing the vaccines that our adult patients need across the lifespan and important considerations as we work to increase vaccination rates. For adults, we often think of vaccinations as a seasonal activity. We're just wrapping up flu vaccine season, and this year we've also had updated COVID 19 vaccine, and for some, the addition of RSV vaccine. While it's good to keep up to date with these annual vaccines, we do need to focus on lifelong vaccination needs as adults. Tamara, why do you think it's harder to manage adult vaccines than vaccines for kids?
So, for many children, they need vaccines to meet specific requirements, such as for daycare, schools, and camps. And their vaccine schedule is usually managed by their parent or guardian. It is also an important component of their well child visits. So, for children, it's more on the top of mind to receive vaccines. However, as children get older into teenagers and young adults, there are fewer recommended vaccines, but more so, they sometimes may not see their doctors as often. But as you know, we continue to have vaccination needs well into these development years. And obviously, as we get into adulthood, especially when some develop health conditions that they may need more protection for.
So let's talk about when adults need to get these vaccines. Luckily, we don't have to memorize all of this information and we can refer to the CDC immunization schedule. Remember, there's actually two ways we can view the schedule. The first is based on the age of the patient, and the second is based on the indication. So let's talk about age first. There's actually four categories of ages: 19 to 26, 27 to 49, 50 to 64, and finally 65 and older. And with regard to indications, they include pregnancy, immunocompromised, HIV/AIDS, asplenia, end stage renal disease or hemodialysis, heart or lung disease or alcoholism, chronic liver disease, diabetes, healthcare professional, and men who have sex with men. For those aged 19 without any additional medical conditions, they actually need five vaccines. They need influenza every year, Tdap every 10 years, and then we have HPV using a catch up schedule for those aged 19 to 26, and shared clinical decision making for those aged 27 to 45. Also, meningococcal B, we also have shared clinical decision making. And finally, we also now have hepatitis B indicated for persons aged 19 and over. What about older patients, Tamara?
Well, Cherokee, I'm going to use the term seasoned instead of older as I am approaching this age category. But at age 50, we have herpes zoster. At age 60, there's a consideration for RSV that should be a decision that is shared between the patient and their provider or pharmacist. And at age 65, the pneumococcal vaccine. So even though for COVID 19 and RSV, we are still awaiting recommendations regarding annual or recurrent vaccines, as pharmacists, we still have an opportunity to engage patients to use us as an information source. As it relates to COVID 19 and RSV, we can help patients understand the severe clinical outcomes of vaccine preventable diseases overall, with a focus on respiratory diseases. As pharmacists, we can explain that it is difficult to prevent respiratory illnesses, and vaccines don't keep the virus from entering the nose or mouth. But the role of the vaccine is to help our bodies fight off the virus once it enters our nasal and oral pharynx and the lungs. Vaccines do a great job of preventing severe illnesses, hospitalizations, and death from these viruses. So when the guidance do come out, as patients have questions, we have the opportunity to provide them answers. There are also several points during an adult's life during which multiple vaccines are recommended. The co administration of these vaccines during the same visit to the pharmacy can help keep our patients protected and avoid unnecessary return trips to the pharmacy for follow up doses.
That's certainly a lot of information we just discussed, Tamara. And we mentioned a couple of times that some vaccines were recommended based on shared clinical decision making. So let's make sure everyone actually understands what that is, given it's a relatively new addition to the schedule. Shared clinical decision making is an approach where patients and their healthcare providers work together to make decisions about specific vaccines using information that balances the benefits and risks of those vaccinations. And it also considers patient preferences and values. Shared clinical decision making is used for the following vaccines: meningococcal B vaccine for adults through age 23 of years of age, HPV vaccine for adults 27 to 45 years of age, RSV vaccine for adults 60 of age or older, pneumococcal conjugate vaccination or PCV20 for adults aged 65 years and older who have previously received PCV13 and PPSV23 vaccines, and hepatitis B vaccinations for adults aged 60 and older who are not at high risk. Now that we've reviewed this information, Tamara, why is this focus on adult vaccination so important?
It is. First, let me tell you what evidence we have. So, in order to assess vaccination coverage among adults aged 19 and older, the CDC analyzed data from the National Health Interview Survey, or the NHIS. The NHIS is a continuous cross sectional national household survey of the non institutionalized U.S. civilian population. So, when we took a deep dive into this report, we realized that there are many adults in the United States that remain unprotected against vaccine preventable disease. As an example, the hepatitis B vaccine was just recently added as a recommendation for persons aged 19 to 59. And many in this age group may not have received the hepatitis B vaccine as a child. And so, in the report that was published in 2021, only 30% of adults aged 19 and older received 3 doses of Hep B vaccine based on their own reporting. And because of that, we still have about 3,000 acute cases of a hepatitis B annually, which would be reduced if more people got the Hep B vaccine. And in 2017, only about 35% of persons over the age of 60 received the zoster vaccine. Now, for any of you that have interacted with anyone that have shingles, we know that that is so painful, but it could be prevented. There are still about 1 million cases of herpes zoster each year. Vaccination has been demonstrated to reduce cases by 89%, and that is something that we should share with our patients in order to protect them. And then for Tdap, only about 1 out of 3 adults aged 19 to 64 and 22% for those aged 65 and older received Tdap in the prior 10 years. There's certainly a lot of opportunity to support adults with their vaccination needs. So, in order for us to support our adult patients, we have to understand the obstacles. And there's a variety of them that contribute to the low adoption of immunization among the adult population. These hurdles include the absence of healthcare provider endorsements for vaccinations, misunderstandings about vaccination needs, insufficient insurance coverage, and underutilization of evidence based approaches such as standing orders or reminder recall systems to enhance routine adult vaccinations. So in 2015, there was a National Adult and Immunization Summit. And there at that summit, a work group report indicated that racial and ethnic disparities in adult immunization coverage persist for several vaccines, including pneumococcal, hepatitis A, hepatitis B, herpes zoster for shingles, influenza, and the human papillomavirus, or HPV, and the Tdap vaccine. with lower vaccination coverage among racial and ethnic minorities compared with the already low ones that I just mentioned with whites. So, persons who lack health insurance, have lower income, or have less education also have lower vaccination coverage. And we highlight these populations so that you, our listeners, as our pharmacists in our communities, know who some of these conversations really need to be targeted towards. And these barriers, they prevent not just individuals, but whole groups of people from being up to date and being disproportionately susceptible to vaccine preventable diseases.
Thanks so much, Tamara. We certainly have a ways to go to close some gaps in adult vaccinations, which is why it's so important to continue to build this mindset of lifelong vaccinations. So let's talk through some strategies to do so. And I think the very first step is to actually keep that conversation going. We need to make sure that we're regularly checking with our adult patients about their vaccination needs. It's easy to ask them questions whether they're at the pharmacy to pick up or drop off a prescription. And keeping a vaccination schedule nearby might even actually help us with that conversation. We can also advertise the vaccines that we have available in the pharmacy so that they know that they can get them at any time when they come to visit us. As we talk to our patients in an effort to reduce vaccine hesitancy, it's important to listen to what a patient is saying during that conversation. And finally, also letting them know that you will continue to be available for them when they're able to make a decision about receiving a vaccine.
Thank you so much for reiterating that for us. So we know that as we recommit to empowering your patient with an open environment to talk about vaccines, it is inevitably going to lead to more people wanting to get vaccines at your store. And so we will be remiss if we didn't mention that we know that the workflow can be overwhelming. So, just a few tips to optimize your workflow so that as we are empowering our patients and increasing access to vaccines, that you are not overwhelmed as a pharmacist while you're doing this. So, first, just plan for and manage high volume vaccine times, traditionally between September through March. Change staffing metrics when needed, encourage patients to make appointments, and also offer on site and off site vaccine clinics with help from pharmacies, not during just the traditional flu season time, but during the rest of the year. So between April and August, when we can administer some of these other vaccines. It's very important for you and your staff to stay up to date and also openly communicate with staff so that you can have the workflow that is optimized for you and your staff. And don't forget that it is safe to co administer several vaccines at a time to optimize your pharmacy workflow. This is also more convenient for your patients.
Thanks, Tamara. Those are all great tips to kind of make it a little bit easier in our pharmacy spaces to be able to give vaccines. I've got a couple other tips to share with our listeners. The next one is taking stock of those partnerships to help support this work of vaccinations for lifelong needs. Partnering with providers to identify the vaccination needs of their patients and making them aware of vaccinations available at your pharmacy helps those providers ensure that those patients are protected. And they can actually refer patients to your pharmacy if they don't regularly stock those vaccines. Finally, talk to your community partners about meeting vaccination needs all year round. And in the fall, there are many more clinics that are held, but what about the remainder of the year? Vaccination needs to always exist. Consider hosting a spring vaccination clinic for vaccinations like herpes zoster or pneumococcal vaccines.
And last but certainly not least is to stay up to date. We know that this can be hard sometimes as vaccination news and updates come very frequently. However, there are several resources that are available to make sure that you can stay up to date. Consider having a go to resource that you choose that you know you're going to go to on a regular basis, maybe monthly, to look at to see what are the new and upcoming changes for vaccines. Some of your organizations will have immunization leads or coordinators that can share this information. Ensure that you are reading the messages and joining updates as they come in. Oftentimes, it's your patients that may come to you with questions. So listen to what they're asking and what they've heard to help you guide what information you may need to seek out. Some regular resources that we use are information including APHA and immunize.org. We usually go there for quick updates and then head to CDC and MMWR to pull down the specifics. APHA offers regular immunization updates several times a year, especially as the ACIP meets multiple times a year to review new data to make recommendations. And they no longer wait until the next publication of the immunization schedule to finalize them. So updates are now being made year round. So attending updates can help you to keep on top of things along with other sources of information we've shared. It also may help you to do your CEs all throughout the year as well. We've also mentioned working with our student pharmacists to help you keep up to date. They are great to conduct in-services to your staff, to provide quick information, and also help you update any information to keep your immunization services on track.
Thanks so much for joining me today, Tamara. And that's all for this podcast. We appreciate everybody joining us for this brief exploration of discussing lifelong vaccinations needs with your patients. Remember, pharmacists are instrumental in protecting our community against vaccine preventable disease. We hope that we gave you some tools today to make it easier for you and your staff. Be sure to also listen to the third podcast in this series where we cover co administration of vaccines in pregnancy. Until next time.